on the mic.
Welcome back to Shrink Wrap Hawaii. I have a very special guest today, Dr. Shari Au, a licensed psychologist right here in Hawaii. Welcome to the show, Shari.
Thank you. Enjoy being here.
I've been looking forward to meeting you for a long time, and thank you for agreeing to come on.
Likewise.
So, I always ask this question because I'm curious. How did you get into the field of psychology?
You know, I was in the field of psychology before I was in the field because I took every seminar, every webinar. I took EST. I had friends in LifeSpring. I really went out of my way to read self-help books. And I think I was exploring that field because of the family dynamics that I came from. Right.
You don't have to talk about that, but do you want to?
I had a shogun-type father who was very authoritarian, and his word was the command, the law in the home. And somehow, when I went to school, I saw so many children who could speak up in their families, who were free to voice their opinions, to have opinions, to voice their feelings. And in my family, that was simply not allowed.
You grew up here?
I grew up here locally, right.
So, was there a point at which you decided, I'm going to major in that in school, or how did that go?
You know, I took abnormal psychology at the University of Hawaii, and I took creative writing at the University of Hawaii, and there was more character explanation, character exploration in creative writing, so I majored in creative writing. But when I looked for a master's degree, I couldn't think of anything else but psychology. In fact, I was in sales for a while, and there was a part of sales that was interesting, but the bottom line in sales is close the sale, close the sale, close the sale. That is the bottom line.
The bottom line is the bottom line.
And somehow it didn't go deep enough to interest me. So I went back and I studied psychology. I majored in psychology at a master's level, and then I majored in psychology at a doctoral level.
And you got your doctorate also from UH?
I got my doctorate from Capella University.
Oh.
I started with Forest University Professional Psychology, which turned into the American School of Professional Psychology, which turned into Argosy University.
Oh.
Right.
So, from our conversation through email, you have a certain specialty that I'm sure our viewers would be listening to as the little snappy title of our show, Love, Sex, and Abuse.
You know, I've been fascinated by the number of clients that are surfacing who are either victims of abuse or who, on further questioning, actually are abusers, are perpetrators. And having studied, you know, Gottman, he has 30 years of research in the field regarding what is the foundation of marriages that are successful and what is the foundation of relationships that do not succeed. There isn't a lot about abusers in that. I have studied Sue Johnson, who has wonderful work in emotion-focused therapy, and she talks about all the requirements to working through the relationship, but not a lot about abusers. So when abuse started surfacing, two things happened. It triggered memories that I had that apparently I've denied because it was normal to me to grow up in a family where my father would shout and everyone would jump, or my father would yell or everyone would jump and my father would scream or swear, and we all obeyed you know, without question. So I started studying abuse, and what I discovered is abusers have a very specific profile. There are soft abusers and hard abusers. There are abusers who have, whose pulse actually go down before they erupt. So these are silent abusers who you will not know when the eruption is coming. It will simply explode unpredictably. And there are abusers who You can see the agitation. You can see the change in their facial expression. You can see them building before they actually erupt. So the moment I have young women coming into my practice who start talking about, you know, out of the clear blue sky, I have no idea what I did. I didn't do anything. He was looking for socks. Suddenly he was screaming at me and I was shaking. I was really afraid. I know instantly, you know, that is someone who has a specific pattern, and the profile is really quite classic.
How do you know when it's abuse? Because everybody has, you know,
Right.
arguments at one time or another. We all shout.
That's
at
a
each
really
other.
good question. When I confront someone who has a pattern and they are not aware that the pattern is abusive, typically I will get a sheepish response. I'll say something to the effect of course you know that's coercion. When you threaten in that manner in order to force her compliance, that is coercion, and that is abusive. I will get a response of, oh, I didn't mean to or intend to, or, you know, that wasn't the, you know, I wasn't going to abuse her. I mean, it didn't occur to me. And there's an apologetic backstepping. But when I confront an abuser, I get exactly the opposite. I get justification. I get emphatic
oh, well,
reaction.
she did this and this and this.
Exactly. A lot of blame, a lot of accusation, a lot of simply, in their minds, justification. Recently, a gentleman told me he threw his wife out of the home. And naturally, I asked him, well, are you sorry you did that? Would you apologize? And would you do it again? And he said, no, I'm not sorry I did that. I would not apologize. And yes, I would do it again. That is abuse.
I had that couple too.
Oh, really?
No, but one thing I wanted to say was we're using the pronouns, you know, he and she, as if it's always male perpetrating against a female, and it's not always that way.
Thank you for the question. No, an abuser can be female. In fact, there are many females who are very abusive. I've had a lesbian couple, and with a partner as abusive as any male could be. Physically abusive, mentally abusive, emotionally abusive, sexually abusive. So females can be just as abusive as males.
So let's go to your couple where the guy threw her out of the house, okay? When that's the case, and you're working with a couple, you work with couples.
Right.
Yeah. After you say, well, that's abusive, what then?
He says, but let me tell you why I did it.
Right, that's exactly what happened in my case. Yeah. You know, because there was yelling and screaming, and she's always screaming at me, it's not good for the kids. I can't, you know, nobody can live like that. Of course I threw her out. Then what?
Because I've already talked to the females separately, and when there is any question regarding abuse, you always want to meet with the couple separately. The couples are fortunate when they come to a psychologist who is aware of abuse, because the abuse can actually be exacerbated by a psychologist who handles the couple in the way that all therapists are trained to handle couples in school, which is treat them as equals. You know, it takes two to argue, it takes two to create the relationship. Each person has a part in this, and you have to explore the woman's responsibility as well as the male's responsibility. When you do that, you've just given an abuser permission to continue his rages, to continue hitting if he has begun hitting. There is always verbal abuse before physical abuse, always. So as the verbal abuse begins to escalate, I inform women that they need to listen to their intuition. If you find yourself shaking, if you find yourself terrorized, listen to your intuition. It's telling you something. Because after the verbal abuse heightens, then if that doesn't work for the abuser, if he's not getting the kind of compliance and submission that he is moving toward, that's what yelling, screaming, raging, it's about compliance and submission. It's about dominance and control. That is the abuser's modus operandi. So if he's not getting what he believes he should be entitled to receive from his partner, then it will escalate. And how it escalates is, the first step is throwing her out. The next step may be slapping her or shoving her or hitting her.
So, okay, so she's left, taking the baby, living somewhere else, right? And they come to me at that point for counseling. And do you just tell her, don't go back? Or do you, say, don't go back until this, this, and this happens? Where do you go?
I've probably done the same thing you've done. I have talked to her for a couple of sessions, and then I have her husband come in, and I ask him, what is his goal? What is your goal? I have one abuser say, my goal is communication. And I said,
right.
Great. What type of communication? And then he proceeded to dominate the session and talk over me when I would give him feedback and accuse her of being the reason for all of his rages. So the second session, I proceeded along, I want to help you achieve your goal of communication, and you may need to make a choice between domination and control, and intimacy, disclosure, and communication, because they do not coexist. And he proceeded to dominate and control.
You in the session?
Yes.
Right.
Okay, so formally, before I began giving him feedback, he was simply blaming and accusing his wife. But as I proceeded to point out to him, well, what I hear is you've started the session and you've proceeded only talking about her and everything that she has done wrong, and justified your reasons for yelling at her and throwing her out. So I want to encourage you to talk about yourself, because you cannot change her. She has to change herself. You can change you. And if communication is truly what you want, then let me share with you that accusing and blaming her does not build communication. In fact, it's a block to it. Disregarding what she just told you, she told you she was hurt and she felt rejected when you threw her out. Disregarding what she just said does not build communication. Communication is a two-way street, among equals. But if you see yourself as superior and dominant, then you can't see yourself as equal, and that is a block to communication. So I would just encourage you to consider it.
Do you also, when you get him talking about himself and his own feelings, do you take him back to childhood stuff?
If he were personally motivated to...
Yeah, let's say he says all the right things. I want to make this work. I love her very much. I want to be a good father to my child. He's saying all the right things.
If he's saying all the right things, the next step is, well, then I'd like to invite you into individual therapy, and let's explore some of the reasons why you react the way you do. Because now that you know that your reactions have a dynamic of controlling the situation, and controlling the situation does not promote communication, we can go back and explore the causes for whatever is triggering you, and we can resolve those causes. If we resolve those causes, you may find that you don't have as strong a reaction to those situations.
That's great, because that brings me right to my next question. You have some special training in certain techniques that I'm guessing that you use, helping people to explore history and how to change responses to triggers. You mentioned EMDR. I know you use a lot. Could you tell us a little bit what that's about?
I'm not alone in this training. A lot of therapists have training in EMDR.
Right.
Eye movement desensitization and reprocessing. It was developed by Francine Shapiro, and it has 3,000 publications verifying that evidence-based.
It's effective.
Evidence-based. It's also in the guidelines of Veterans Administration, of the Department of Defense, and the American Psychiatric Association. So I started using EMDR actually with military spouses. I had a young woman come in because she had delivered a stillborn child. In fact, she didn't come in, she had her roommate bring her in. The doctor had called me and asked me if I could see her.
It's a terrible place to break, but they just told me we need to break it. We'll come right back to that. You're watching Shrink Wrap. Don't touch your mouse. We'll be right back.
Aloha, my name is Carl Campagna. I'm the host of Think Tech Hawaii's Education Movers, Shakers, and Reformers. You can see our show every Wednesday at noon at 12 p.m. on thinktechhawaii.com, as well as visiting YouTube and finding the link for the show there. The show is also aired on OC16. We look forward to seeing you on the show. We have many wonderful guests, including Joan Husted, Corey Rosenlee, where we talk about the very important issues of education for our keiki. We look forward to seeing you there. Mahalo.
We are back with Shrink Wrap. I'm with Dr. Shari Au, and we were just talking about the way Dr. Au uses EMDR, and you were telling us about a woman that came in and had a stillborn child?
Right. EMDR uses bilateral stimulation. Bilateral stimulation activates the corpus callosum, the nerve fibers between the left and right hemispheres. Keep in mind your brain can only maintain one state at a time.
One state meaning state of emotion?
State of emotion. You cannot be happy and sad simultaneously. You cannot be angry and calm simultaneously. When you are calm, the corpus callosum is active. Both hemispheres.
Where is that?
Corpus callosum is right
Frontal
between.
lobes.
It's between the hemispheres.
Okay.
Okay, you have two hemispheres, left and right hemispheres. They talk to each other.
Okay.
And they talk to each other through the corpus callosum.
Okay.
And when your brain is in a calm state, the blood goes through the brain, it goes to the neocortex, your problem-solving center. This is the reason, you know, in martial arts, they say you must be mindful and keep a calm state. Even at the height of getting ready to kill your opponent, you must be calm.
Right.
Because you can only problem solve efficiently when you're calm. So what we do is we hold the trauma state and we use bilateral stimulation, which is the same thing that your brain normally does in REM sleep. Rapid eye movement.
Dream sleep.
Dream sleep. Rapid eye movement to resolve issues that you've had during the day. Unfortunately, traumas become frozen in the brain. They are not resolved. This is the reason why when you think of a trauma, all of the old emotions come up.
Right.
Yeah, you might even, your hands might perspire, your heart might race. When you're in a situation.
Old emotions, you mean ancient, like primitive.
Right. If you've had a past trauma and you're in a current day activity and you are triggered, suddenly you may re-experience the same emotional reactions that you did when you had the original trauma.
I understand that. So tell me what you do with the bilateral stimulation. How does that work?
Francine Shapiro developed a very, keep in mind, Paul Dennison has been using bilateral stimulation with learning disabilities for 50 years before EMDR came through, but Francine Shapiro developed a very...
Oh, is that the brain gym stuff?
That's right.
Okay, because
exactly
I was
right.
a special ed teacher, right? We did
right.
That. It's the same thing.
Well, it's not the same thing, but
it uses the same...
It uses bilateral stimulation, and you'll know that the lateral eye movement, that you recognize that from Brain Gym. Okay, well, Francine Shapiro developed a very specific protocol, and it's a protocol that works very well with trauma, specifically with trauma. So as we move through the protocol, let me go back to the young woman who delivered a stillborn child. She couldn't get up out of bed. She wasn't going to work. She wouldn't answer the phone. Her roommate brought her in, and in one session, we resolved her depression over delivering a stillborn child.
Could you demonstrate the technique?
The technique is simply bilateral.
So I watch your fingers going back and forth.
You watch my fingers going back and forth. It's a very simple technique. Now, it's not so much the technique that makes all the difference. What it is the process, the protocol that we go through.
I'm feeling myself relax as I do this.
Don't relax too much. We're on camera. Okay.
No danger of falling asleep. So then what?
It's a very basic technique.
Do you talk while you're doing this?
Sometimes it's called an interweave, but what I do is I check the process that you're going through. And typically what people go through is sometimes the trauma can get more vivid initially. More often than not, the trauma becomes less vivid. It becomes, if it was moving, it may stop moving. If you were immersed in the trauma, it may feel increasingly more distant. People have reported, well, you know, I could hear this voice screaming at me, and then now I don't hear any voice. Or
just from doing this?
It's not just that.
Okay.
But that is part of the protocol. So we move through the protocol. That's like asking me, can you demonstrate a hypnosis protocol?
Right.
There's more than just, you know, 3, 2, 1, you're just relaxed and then I'm going to talk to you.
No, I understand.
Yeah,
I understand.
okay.
But before you begin, like I know you also have worked with thought field therapy and
Right.
and EFT, emotional freedom technique,
Right.
Which are different but similar in certain ways. And in those kinds of therapy, they ask the person to put themselves back in that heightened state of arousal or anxiety. And you know, and then I know with TFT, you tell the person, okay, imagine that's happening, and you're getting yourself as worked up as you can until it's a 5 on a 0 to 5 scale, and then you do the tapping stuff and the closing your eyes at the whole, I forget what they call it, rigmarole.
Right.
And then gradually you bring it down to a 0 fully.
Right.
So is this similar to that?
You use a subjective unit of distress, which is give me a number from 0 to 10 and tell me how disturbing is this event to you. The reason we want a measure at the beginning is we want to know if there's any progress.
If it's working.
We want to know. And this gives the client a measure to know, because very often when something that is a deep trauma is resolved in one session, there's a little disorientation at the end of the session, like what happened?
Right, and then sometimes a denial that anything is better.
Usually the denial comes in the form of, I don't understand, I remember it, but I just don't feel the same way about it. It just, I don't understand what happened, but, you know, and I encourage people with, you know, we're not going to erase your memory. Your memory is going to remain intact. What we are resolving is the emotion, the negative emotional charge associated with the memory. So I want you to check your emotions. Just scan yourself from head to toe and tell me where in your body you feel that emotion. And when they cannot find it, then it's a 0, right?
Well, I don't know about that. Because as a man, who typically I think is less in touch with them, I don't mean to generalize, but my experience, I should say, is if, like you ask me at any given moment, how do I feel?
Right.
I don't know.
Okay.
And if you say, you know, I feel anxious, and then you say, where in your body? I don't know.
Right. If you're walked through the process, it's much easier.
Say that again?
If
I'm walked through the whole process.
Right. If you have someone lead you by the hand through the process, it's much easier. Because I have had men who come in and they say, well, I want to work on this, and we find out that the issue is not that. So we work on something else, and we kind of go through their history, and we find something that they didn't realize was a trauma.
Like your father shouting at you.
My father shouting at me, or I had one young man who had some type of health condition as a child and was hospitalized for 4 years. Now that's a major trauma. Going in and out of the hospital,
And he didn't
having
realize
spinal
that
taps.
this was affecting his current life?
Yeah, he didn't realize it. Because you don't think of hospitalization as trauma per se. You think of rape as trauma. You think of being beaten up as trauma. You don't think of hospitalization where you're held down by nurses so that they can do a spinal tap or so that they can do a bone marrow implant or, you know, whatever. This young man was, you know, held down as a child for medical reasons. And he never recognized that that was very traumatizing, and he harbored a lot of helplessness and anger and feelings of betrayal, because he said the nurses and the doctors were so nice. They were so nice to me, and then they hurt me so badly.
Wow.
I mean, you know, as an adult, you can form those concepts. As a child, he had no idea what was happening.
And so that this man must have had problems maintaining intimate relationships, because how do you trust somebody when these nice people hurt him so badly?
He had problems with alcoholism, he had problems with drugs. So, you know, when you get into deep traumas like that, suddenly there are major shifts in your life. I've had men tell me, you know, I didn't realize that was trauma. I didn't realize my mom being an alcoholic was a trauma to me. But for the first time in my life, I called people together. I, you know, ordered some pizza, had some drinks, and we had a party. And for the first time in my life, I had no anxiety whatsoever. Normally, I'm a nervous wreck. I cannot be around people without being always on edge, trying to be perfect, trying to, subtle shifts like that, very subtle.
And so when you worked on the early trauma, it reduced the anxiety?
It eliminates the triggers. If we get at the cause, the triggers are no longer there. Recently had a gentleman come in and he told me, oh, I think what we did is working, because the last time we worked on my anxiety, and I went to a party, and normally I feel really uncomfortable at parties, and I'm not sure what to say, or, you know, and I just occupy myself with eating. So he said, for the first time, I wasn't nervous at all. And then people were talking about anxiety, of all things. And I sat there, and I wasn't nervous, and, you know, I had no anxiety, no apprehension, no discomfort. Everything was just fine. It was for the first time.
That's such a common fear, though, that thing of going to a party. Mm-hmm. I mean, I think it is. Maybe it's just me. You know, if you don't know the people at the party.
It is a common fear, and it's not common to everyone.
Aha. I need to do this.
Yeah, maybe. You'll have to come in.
Okay. Wow. So getting back to the abuse situation, so you work with this guy who's abusive, and he's willing, and he does this work with you, and maybe goes back and...
This is your hypothetical guy, is that right? Okay.
Right.
So if we resolve the causal events that led to his hyperreactivity, he will have fewer triggers, because once the cause, it's like it has a domino effect. You have a cause here.
Yeah.
And every current event that is triggered accumulatively adds to that causal event.
So it gets worse.
It's like holding a balloon underwater. The balloon gets bigger as you repress it. So as we resolve this causal event, suddenly all of these other triggers kind of fall like a stack of dominoes. There's nothing to be triggered anymore.
Wow.
If there's nothing to be triggered, there's no reaction.
Okay. We will be right back. It's time for another break. Don't touch the mouse. Shrink Wrap Hawaii. We'll be back with Dr. Shari Au.
Aloha, welcome to Think Tech Hawaii. My name is Josh Green. I'm the host of a program called Healthcare in Hawaii. I'm a physician. I work in the emergency department on the Big Island. I also serve in the state senate, which, please don't hold that against me, doesn't detract from my television program. We speak about all the big healthcare issues in the state. We get together on Tuesdays from 2 o'clock till 3 o'clock in the afternoon, and we try to talk about the most important issues in healthcare. This is a terrific venue for people to learn about healthcare. There are many programs on this station. We broadcast it later, not just on the internet, but also on OC16. Thanks for joining us. Please be informed healthcare consumers.
Hi, I'm Donna Blanchard. I'm the host of Center Stage here on Think Tech. This show is so very dear to my heart. We talk with artists of various different ilk here about the process that they go through for their art. So we talk about what they're doing, why they're doing it, how they do it. It's a show that is inspiring. This is what I hear from people all the time. And a show that will teach you something, sometimes something about yourself. I hope you'll join us. The show is Center Stage. It's on Think Tech every Wednesday at 2 o'clock. We'll see you then.
We are back. I'm Steve Katz, marriage and family therapist, with Dr. Shari, a clinical psychologist. So, getting back to the name of our show, there was a question that has always fascinated me, and I think a lot of other people have a hard time understanding that. A person is being abused, maybe over many years.
Right.
And all of her friends and family are telling her or him to leave, and they don't.
Mm-hmm.
What's that about?
An abusive relationship is far more difficult to leave than a healthy relationship. The reason being, intermittent reinforcement entrenches a pattern far more resiliently than consistent reinforcement.
So it's like this, the one-armed bandit thing, where you get a payoff every 10 times or something.
Exactly. And it's like panning for gold. You know, if you pan for 3 weeks and suddenly you find gold, it encourages you to continue panning.
Right.
And if you pan for 2 months and suddenly you find gold, it really reinforces you to keep on panning. And if you pan for 4 months and then all of a sudden you hit gold, boy, you're never going to stop. You're going to keep going, because that intermittent reinforcement tells you that there just might be a reward after this. It just might come together. There's always that hope.
If only I say the right words.
And the abuser tends to implant in the victim's mind that you're not intelligent, I'm intelligent, I'll tell you what to think, I'll tell you what to do. It doesn't matter how. Abuse transcends all socioeconomic classes. Mm-hmm. It transcends all educational levels. It transcends all ethnicities. And it transcends finances. It doesn't matter if she has more money.
Is there any, are there any predictors of people that will get into abusive relationships?
If the woman is going through a transition, say she's just graduated from school and she's unsure about the direction to take or a job situation, she becomes vulnerable.
So the typical runaway who gets picked up at the bus station.
Yeah, similar. There's a vulnerability there and that uncertainty, and she's more susceptible to being wooed. Now, abusers, there tends to be an intensity at the beginning of the relationship. Keep in mind that an abuser is an insecure person. Mm-hmm. This is a person who exudes confidence but has an innate insecurity. So you have this polar opposite. When an insecure person wants to present this charm or confidence or whatever the facade is, he's going to work extra hard at it. And there's an intensity at the beginning of these relationships with an abuser. Let me give you an example. I had a friend whose husband, she had broken off the relationship with him, and she went on to college. He drove across 3 state lines to her college to ask her to marry him after she had broken off the relationship. Now, after he did that, she could not figure out how she could say no. Okay?
He had been previously abusive?
He had not been previously abusive.
Uh-huh.
So, but the intensity with which he pursued her. Now, after they were married, he proceeded to cheat on her and tell her about it. And at first, she was crushed. He continued to tell her about it, and she could never figure out why. Why didn't he just do this with some discretion? Uh-huh. The final blow, they wanted to have children. They had a second child. The final blow came when he had an affair with the babysitter. He was military. They were in Germany. She spoke no German. She was living in Germany. She knew no one. And her husband wants to move out and live with the babysitter. And she has an infant and a toddler. Oh. This is abusive. This is called,
she's helpless.
This is called emotional abuse. He has never hit her. He does not scream at her, but he does things that wound her repeatedly. And he knows that he's wounding her repeatedly. So what she did was she worked on a master's degree. She has a master's degree in counseling. The moment she got her degree, she moved for early return of dependent and came back to the USA. Now, she said the oddest thing happened. When I told him that we were leaving and I thought he might want to see his children, so he drove us to the airport, I could not understand why he was so angry at me. He was angry because he had lost control. Remember, modus operandi of abusers is dominance and control. He had lost control, even though he was not living with her. He was living with the babysitter.
So, yeah, it's not reasonable, not logical.
Well, you know, the stories go on and on. Nicole Brown Simpson. One of the statements that she made was, I should have been more patient.
Oh, it just hurts your heart to hear that. Because, I mean, there's really nothing that you can do short of leaving, I think, in a situation like that.
Now, the longer you stay with an abuser, the more dangerous it becomes.
Right, because they keep upping the ante.
Exactly.
Yeah.
So in her case, she was so young and she was so impressionable. In 5 days, he had bought her a car and her own apartment. So that's very difficult to resist, granted. And he took her around the world, he took her on trips, you know, the best of everything. And when you're young and impressionable, even if you're not young and impressionable, that's pretty overwhelming.
Very, yeah.
Famous,
yeah.
A completely high-end lifestyle that was so different from anything she knew.
How can you say no?
How can you say no? And then he began to fly women into the hotels that they were staying at. And when she discovered that he was having, you know, ongoing affairs, she spoke up about that. And he apparently perceived that as his losing control or her not being submissive or whatever that was. And we know the end of that situation. That was unfortunate.
So, going back to our theoretical couple again, right?
Okay.
So, let's say in the scenario that you just painted, this man finds this vulnerable woman and courts her extensively, makes her think that she's the best thing since sliced bread, and they get together, and then it begins to go south after they've had a child or two, and then you work with him, and he gets to some of his core issues, his trauma, and is it possible for them to reunite?
It's possible to reunite if he is truly invested in changing himself, if he is truly committed to working on the relationship and working on himself. It becomes impossible, and this tends to be more the case because abusers are very notorious. Their belief system tends to be one of entitlement.
Right.
I am entitled to recognition and acknowledgement, regardless that I do nothing for it. This entitlement really puts the woman in a one-down position. The abuser is also competitive. He does not anticipate having to compete for attention, for nurturance, for anything that he believes he deserves. So she cannot consider her family more important. She cannot consider the children more important. She cannot consider her friends more important. And the longer she stays with him, the more dangerous that can become. The first thing an abuser does is isolate. He isolates her. So she is entirely dependent on him for emotional support. Why is it so difficult for her to leave? Because she believes she's in love. He is her world. He is her entire emotional support system. There's nobody else. So if she leaves, she loses everything.
And also, he's isolated her. So by that state, there might not be a place like your case of the woman in Germany, your friend. There might not be anywhere for her to go.
There was no place for her to go. She had to negotiate. If you will continue, we will live. If you're going to live with the babysitter, and you will you know, allow us to live in the family home, the military on-base home, we will stay. Otherwise, you know, there's no reason for me to be here.
Right.
So he did that, and she was able to finish her degree, and that was important. That was smart.
So in a way, she was lucky in a way that he found this babysitter to live with, and it kind of set her free? Rather than continue in an abusive relationship?
You know, I guess you could look at it that way. Certainly she was heartbroken.
Yeah.
That was the final straw, to have your partner that you believe you're going to spend the rest of your life with, you know, up and leave with the babysitter. It's shocking.
So if that doesn't happen, we're back to our first example, and you work with the abuser, which we keep making the man. My manhood feels a little hurt. Like, you know, it can't be a woman, as we said, right? Men do get abused by women. It goes the other way, too. I know not as often, but it happens, yeah?
Typically, the damage is not as severe.
Because they're not as strong.
Typical male, same weight, same height female. The male automatically has larger heart, larger lungs, larger musculature. He's just going to be stronger, at least twice as strong as she is.
Also,
regardless.
do men have trouble admitting to being the one who's getting abused?
You know,
or even seeing it?
I think a lot of men accept it as that's just how she nags. She's a nagger.
Right.
She'll complain, and they will.
So that can be abuse too.
It is abuse.
Uh-huh.
But
so how do you tell the difference between everyday nagging and abuse?
You know, it really depends on the partners. Because I've shared with one woman whose partner is very verbally abusive and is gradually moving into physical abuse. I've shared with her, you know, some women continue with their partners and they acknowledge and recognize that their partner is abusive and they accept that. And that's a fact.
Yeah.
Some men continue living with their partners, knowing their partners are abusive, verbally abusive, emotionally abusive, and they accept that.
So do you take a position? Will you tell a man or a woman or a couple that, in your opinion, they should split up?
No. I will tell a victim that she needs to acknowledge and name the behaviors that are occurring. Because most victims, when they come into counseling, are unaware they're experiencing abuse. In fact, you know, it won't come up unless
Does the naming of it help?
Yes, very much so. Because I've got a gal who's been married for 28 years to a verbal abuser, and she never knew he was verbally abusive. Suddenly the kids are in college, and one son is you know, self-medicating with drugs, and the other son is, you know, so neutral that it's almost it's uncanny. You know, he won't take sides. He won't take sides. He won't take sides. I think he's afraid of taking sides for fear of the consequences. But when you have effects such as victim being thrown out of the home and being told she will be thrown out again if she doesn't comply. If she speaks up, if she has a mind of her own, if she shares her feelings and he doesn't agree with those feelings. I don't take sides, but I do encourage women to be aware of what is happening and what could happen in the future. I have told women the longer the relationship continues, typically the more dangerous it can become.
They're telling me we need to wrap up. I'd like to do this for another hour. Dr. Shari, thank you so much. I hope that everybody has learned as much as I have today.
Great.
Thank you for joining us.